are in the fifth wave, and as the discussions will continue, you will discern some variations or differences between this wave and previous waves. And so this is not a signal to panic, although we must be mindful and we must take care to protect ourselves against the virus. The ministry reminds the public, or would like to remind the public, that vaccines are widely available to protect you from severe illness. All persons 12 years and older should visit any of the over 100 vaccination centers to be vaccinated if they have not already done so. Persons who are eligible for boosters are encouraged to take the booster dose now, as their level of protection may have waned over time. And this is an important note. If you have not taken your third shot, then it is a good time to take it, because this will add to your resistance or response to dealing with the virus. And this, of course, is the most effective response. We may sound like a stuck record, but vaccination continues to be your best protection. And unfortunately, too many persons are not. 97.5% of those who are impacted hospitalization-wise are unvaccinated. And so we continue to urge persons to get vaccinated. But I would not leave my mask or my sanitizer, and I would protect myself in the situations where I think I'm exposed to multiple persons, because the virus is highly contagious. To keep our children out of school beyond the 2+ years that they were out would have had and has had a debilitating effect that is far more intense than them being in the school environment, even at the risk of contracting COVID. The evidence is suggesting, the data, that while we are having cases in the schools, and the schools do have a capacity to do testing, working with the Ministry of Health, we have the home test kits, and if there are further suspicions, we elevate that to the health centers or the hospitals for further testing. While we are seeing positive cases, we're not seeing cases that are severe to the point of hospitalization or even death. And that is the normal trend globally. And I think that's very important. So I'm not suggesting that it is risk-free. I'm suggesting that we are suggesting as a government that there is a greater risk to isolating them for so long.
We again disseminated a recent bulletin to the education system, alerting our stakeholders about the current situation and reminding them to enforce the COVID-19 protocols to ensure the safe operations of schools. School administrators were also asked to resensitize all key stakeholders about the protocols to be observed, including the frequent washing of hands, temperature checks, wearing of masks, mask breaks, and so on.
While the majority of cases appear to be mild, persons with comorbidities are at risk for severe illness, and persons who have mild symptoms and no symptoms may be at risk for developing long COVID. And so the public is therefore encouraged to practice infection prevention control measures, including the wearing of masks, hand washing, physical distancing, and very importantly, staying at home. If you are sick, the protocols are there around staying at home. If you are positive or if you feel ill, then you really ought to stay at home. And I think the protocol is up to 10 days and then you return. With all of this, of course, we're trying to balance the normal restoration of activities in the society and the risk that is posed by this.